Hello, a new update on Wednesday the 4th of September when I've just been to see my oncologist after 2 weeks. Bit background, so I was in Belgrade before that. We learnt a lot about the history of the city and that area in Yugoslavia and how that split up and what's happening in Serbia and Kosovo. Very interesting trip. Came back a few hours later because the plane was a bit late. I ended up 8 hours later actually. I was in the hospital and having scans, MRI and CT scans. Come to the results in a minute. Then I had a sort of social week in Cambridge and London. Lisa went off hiking in Austria, where she still is. My health has not been too good because I've had quite a lot of problems with constipation last month, which is a side effect from osimertinib. No, it hasn't. I haven't experienced that in 2.5 years. Maybe connected or not. And quite a bit of abdominal pain. More in a moment. So I got to Addenbrooke's and had 3 appointments. So I spent about 6 hours there today. Spent some time with 2 sets of medical technology entrepreneurs, just helping them because they happened to be there. One bumped into me and the other 2 I'd arranged to see. And then we came on to the appointment. And I'd done a 4-page research paper which I'd sent to him, which goes through all the various items that I had investigated and my conclusions. I know that might not be the same as his, and it turns out it wasn't, but we've got a good result. Victor Christou, a friend, came to join me to help, just to listen and talk about it afterwards, because Lisa couldn't make it, although she was at a hut with Wi-Fi, so she did dial in. Scans showed that no new changes in the head at all, which is really good. The tumours in the bone in my pelvis and the lymph nodes around that area have reduced very slightly. I'm not sure there's much difference there. However, the tumour and new tumours, although small, in the lungs are present. The other big one was the liver. It's gone up from 2 to 5 tumours, and quite a few in there. This is over. It's been near 3 and a bit months since the last scan, so you'd expect stuff to happen. So anyway, the conclusion was to go on to afatinib, which is a 2nd generation TKI alone, and then hopefully hope the next line will be this new trial that's just coming to fruition, the Mariposa, which has been accepted in the US, as I mentioned before, and in Europe actually this last week, but not yet in the UK, obviously due to Brexit. The issue is that I've developed a kidney infection and my creatinine level has gone up a huge amount, so they can't start me on a new treatment until they sorted that out, worked out what it was. So I'm back in again at 9 AM to have some blood tests, and then whatever's next, antibiotics, or I just don't know. So I'll talk again in about a week. Thank you. Bye.